In 1996, an unassuming piece of legislation changed the course of wireless communication forever. The Telecommunications Act of 1996 was heralded as a breakthrough for digital connectivity, but hidden within its pages was Section 704, an industry-backed provision that silenced communities, stripped away constitutional rights, and protected telecom profits over human lives. Today, parents like John Coates, who lost his firstborn daughter in 1995 to a neural tube disorder he believes was caused by RF radiation, find themselves legally unable to challenge cell towers near schools on health grounds. His 7-year-old daughter Melanie sits just 465 feet from a powerful microwave tower, and there is no legal recourse to challenge it. This is not just a regulatory failure, it is a premeditated assault on public health and democracy. Section 704, a gag order disguised as policy. Section 704 of the 1996 Telecommunications Act explicitly prohibits state and local governments from blocking the placement of wireless infrastructure based on health concerns. This is a First Amendment violation, preventing communities from citing peer-reviewed science in local zoning disputes. It also violates the 10th Amendment, stripping states and municipalities of the power to regulate public health in their own jurisdictions. It was never about streamlining wireless expansion. It was about eliminating resistance to corporate control. The FCC's 1996 RF guidelines, outdated, overturned, yet still enforced. The FCC's thermal-only exposure guidelines were based on 1980s radar data, long before smartphones, Wi-Fi, or 5G. These guidelines assume RF radiation is only dangerous if it heats tissue, ignoring thousands of studies showing biological harm at non-thermal levels. In 2021, a federal court ruled that the FCC had no scientific basis for retaining its obsolete standards and had ignored evidence of harm. Yet, the FCC has refused to revise these guidelines, continuing to enforce limits that are decades out of date. Children and RF radiation, the unspoken risk. Children are uniquely vulnerable to RF exposure. Thinner skulls and smaller heads mean deeper RF penetration. Rapid cell division means higher susceptibility to DNA damage. Longer lifetime exposure means higher cumulative risk. Peer-reviewed studies show Yale ADHD study in 2012 found that prenatal RF exposure caused hyperactivity and memory deficits in mice. Pearl study on chicken embryos in 1997 showed a 300% increase in neural tube defects from low-level microwave exposure. Devan et al. Human study in 2008 and 2012 found higher prenatal cell phone exposure correlated with behavioral issues in children. Despite overwhelming evidence, no regulatory agency has updated safety guidelines to reflect these findings. The National Toxicology Program's groundbreaking findings and the industry's cover-up. The National Toxicology Program, or NTP, $30 million study, found clear evidence of cancer in rats exposed to cell phone radiation. Shortly after these results, funding for the NTP's wireless research was abruptly cut. This is a direct violation of Public Law 90-602, which legally mandates continuous evaluation of radiation risks. The telecom industry's response? Suppress findings, dismiss concerns, and continue citing obsolete guidelines. They fund studies designed to find no effect and use them as scientific consensus. Public Law 90-602, the federal mandate the government is ignoring. The Radiation Control for Health and Safety Act of 1968, or Public Law 90-602, requires that the FDA, FCC, and EPA continuously evaluate radiation safety standards. This law is still in effect, yet these agencies have failed to update safety standards despite mounting evidence of harm. They have ignored the federal court ruling against FCC guidelines and allowed telecom corporations to dictate policy. This is not regulatory failure, it is regulatory crime. Regulatory capture: the wireless industry writes its own rules. FCC standards were developed by industry engineers, not medical professionals. Section 704 was drafted under telecom lobbying pressure. The WO, once a trusted agency, has been infiltrated by industry-backed scientists. The revolving door former telecom executives routinely take leadership roles at the FCC, ensuring zero accountability. The real solution: safer technologies exist. Leafy or light-based wireless offers no microwave radiation, faster speeds, and more security. Far UV Leafy, patented by John Coates, can also sanitize air while transmitting data. Space-based telecom eliminates the need for ground towers next to schools and homes, reducing exposure with carefully designed shielding strategies. Interferometric array antennas provide a safer alternative to traditional phone antennas, directing RF energy away from the user's head and body. The call to action: we must repeal Section 704 and enforce Public Law 9602. Immediate steps: demand congressional action to repeal Section 704. Americans must be free to challenge RF infrastructure on health grounds. Local governments must regain zoning authority. Enforce Public Law 9602. The FDA, FCC, and EPA must be held accountable for their legal obligation to update RF safety standards. Restore funding to NTP wireless research. Advocate for safer technology. Shift to Leafy, satellite-based telecom, and beamforming antennas. Ban cell towers near schools and residential areas. Final thoughts: a future worth fighting for. If the telecommunications industry had truly prioritized safety, we would already be using radiation-free Leafy, space-based communication networks, and phones with safe antenna designs. Instead, we are trapped in an outdated, corrupt system designed to protect corporate profits over human lives. For parents like John Coates, who have already lost one child and now fight to protect another, this is not just policy, it is a matter of life and death. The telecom industry's deception and regulatory capture must end. It's time for real wireless safety standards, real accountability, and real technological innovation. We cannot afford to wait. Visit RF Safe to learn more.